We didn't know because we were too young and parents weren't educated enough to know what discrimination was.
It was the first time I've heard language such as racism, institutionalised segregation.
We recognised what was happening for travellers in Ireland as racism.
What I would say is being the traveller, being the woman and being the traveller woman, that we would face layers of discrimination.
But now, hell no, I know what discrimination is now.
In 2020, Pavee Point Traveller and Roma Centre won the Max Fairness Dole Award in recognition of its continued efforts to strengthen the genuine integration of Irish society by advocating for and protecting the rights of travellers and Roma communities. Established in 1985, Pavee Point empowers Roma and traveller communities to overcome a long history of multiple and intersectional discrimination. By working closely together, travellers and settled people aim to achieve collective progress for the community and change the perception of settled communities towards travellers and Roma. This is our story.
My first formal introduction to what is Pavee Point today was in January of 1985.
The 1980s in Ireland was a very different place to the Ireland of today. Travellers were somehow delinquent settled people or delinquent non-travellers who needed to be reoriented and reintegrated into society.
It was the beginning of my consciousness raising. It was the beginning of me being politicised around these really important issues that have a huge impact on our community.
We were very conscious of the need for an analysis that understood the structural injustices that were part of Irish society and the structural injustices that created conditions which marginalised travellers and left them on the margins of society.
There was no acknowledgement of our culture, our history, our values and our belief systems. There was no acknowledgement of nomadism and the right to travel.
We're very concerned that the way forward had to be a way that was inclusive of travellers themselves. And finally, we were very conscious from the beginning that traveller women's rights needed to be a substantial part of anything we did.
30% of 16 to 18-year-old travellers are enrolled in secondary education compared to 90% of all 16 to 18-year-olds. The unemployment rate among travellers is 84%. The Irish government published a report on recommendations for a traveller education strategy in 2006. The government is yet to publish this strategy.
For Pavee Point, education has always been a part of the organisation and the community.
We need to deal with the institutional racism that exists in our schools, and our school curriculum needs to be adapted to reflect traveller history and traveller culture so the schools have become a more inclusive environment.
We also used to do call out to schools doing presentations around Pavee Point and traveller and Roma cultures.
We need to put in place strategies and supports to ensure that a lot more travellers are accessing education at all levels.
We would like the traveller education strategy to be implemented, took down, looked into, worked down and implemented.
Have a really positive and inclusive experience of education and come out the other end with qualifications in a whole range of disciplines.
Put out there so more work can go into education because education is very important.
It's really important that we are given these opportunities because the ambition is there, there's no doubt about it.
Across the board, travellers die in greater numbers from all causes than the general population. On average, traveller males live 15 years less than settled males. For traveller women, the gap is 11 years. Infant mortality is 3.6 times higher than the national average.
When we said we knew there was health inequalities, they were saying, oh, well, that's because travellers don't turn up for their appointments. Whereas we knew there was institutional barriers, and racism that was stopping travellers achieving what they should have been able to achieve. If you have no water, no toilets, no electricity, if you have a poor education, if you're unemployed, if you're living in poverty, all of these things affect your health status. We had to lobby for many years until finally in 2008 we succeeded in getting the All-Ireland Traveller Health Study undertaken, and that was published in September 2010.
So it's very important that it was done by travellers for travellers, but also what made it more important, it was done in a way that travellers could understand it, and also people who had huge literacy problems still went out and done research in their own community.
There was some resistance at the start. They were thinking, these aren't researchers, we can't trust these. These were people who couldn't read and write. So we got tablets, little laptops, and so people didn't have to know how to read and write. I remember when we were piloting it, we had a question about water, and we had a tap and we had a glass of water with ice in it. And the traveller said, that's not about water, because if you have ice in a glass, it means you're drinking alcohol, and that tap would be in a bathroom and no one would drink water out of a bathroom tap. So then we ended up with the tea tap, which is what travellers would use outside.
But also what was very important was for us and for myself, there was a voiceover, but also it was colour coded and people was trained on the laptop as well. Don't ever think somebody can't do a bit of research in their own community. If there's literacy problems, there's lots of ways that they can actually do it.
And that gave us the evidence that we now use. We have 134 excess deaths for travellers every year. We know that we have the evidence from the All Ireland Health Study. You have to say, why do 134 extra travellers die than should die? It's to do with the quality of care and the access to services in a timely manner. And that's to do with racism within the health service, whether we like it or not.
In the travel community, there are myths around domestic violence. And one of the main myths, what I would hear very common, is it's part of our culture. It's not part of anybody's culture. Domestic violence is about a person having power and control over another person. But a big part of my work as well is also to work with service providers in the area of domestic and sexual violence. And that work means, by working with the services, that they know that traveller women do face barriers on leaving, being afraid to speak out to services, being judged as a traveller woman. And that kind of comes from the past of the way they were treated, but also to the present.
In 2020, Pavee Point was the recipient of the Max van der Stoel Award.
The Max van der Stoel Award is a prize of 50,000 euros, which is presented every 2 years to a group, a person or an institution for extraordinary and outstanding achievements in improving the position of national minorities in any of the OSCE participating states. The jury decided to honor Pavee Point Traveller and Roma Centre in recognition of its continued efforts to strengthen the genuine integration of Ireland society by advocating and protecting the rights of the traveller and the Roma communities.
I am delighted that the jury selected Pavee Point Travel and Roma Centre, and I hope that this award will bring wider international recognition of the excellent work this prominent organization does to advance the rights of Irish travellers and Roma.
I think the recognition that going the road less travelled is important, and that collective community work approaches which acknowledge racism and are built on rights are fundamental is really very important for us.
I think there are two big differences between now and back in the early 80s. One, obviously, is the recognition of traveller ethnicity. That really was a very historic and symbolic moment in our history as a people. And I think the other big difference between now and in the early 80s is we are very fortunate that we have many, many travellers, men and women, right across the country at local, regional and national level who are doing absolutely Trojan work in representing and advocating on behalf of their community.
I would have never gone to a meeting with the health boards or the HSE or Department of Health, and even now I wouldn't, Minister for Health, without a traveller.
It's also really important that travellers themselves, in solidarity with non-travellers, are actually at the table when these discussions are taking place.
And increasingly over the years, the travellers are leading the discussion and I'm more in the background, So it's around making sure that there's nothing about us without us.
And thankfully on the 1st of March 2017, our then Taoiseach stood up in our national parliament and fully and unequivocally recognised my community as a distinct ethnic minority in the island of Ireland. This can lay the foundations where we can create a more equal and a more inclusive society that's respectful of traveller culture and traveller identity and traveller history.
COVID-19 reached the Republic of Ireland on the 29th of February 2020. Pavee Point immediately recognised that it could have a devastating effect on the traveller and Roma communities due to their existing health inequalities and poor living conditions.
We knew that one of the protections was that you had to do a lot of hand washing and you had to do a lot of physical distancing and social distancing. And we knew that many travellers unfortunately continue to live in very poor conditions.
Obviously, in the middle of a global pandemic, some groups are more vulnerable to contracting and spreading the virus than others. And the traveller and the Roma community in Ireland have been recognised as a group that has a particular vulnerability.
We knew we had challenges ahead. We as travel organisations have been lobbying for the previous 20 years for water, toilets, electricity. We couldn't get them delivered. But because of a public health crisis, because of a pandemic, within a couple of weeks, many of those sites got water, toilets, electricity.
Pavee Point's mission is to contribute to improvement in the quality of life, living circumstances, status and participation of travellers in Roma through working innovatively for social justice, greater solidarity, development, equality and human rights.
It'd be good to see our children that's in the education system coming out the same as any other child and getting a job, no matter what kind of a job that they want.
For young travellers, or even travellers like going back as mature students, to get their qualifications and their degrees and to go out in life and to be where they want to be.
My hopes for the future would be that travellers are more visible. Doctors, solicitors, barristers, school teachers.
You need immediate special measures. And by special measures, I mean direct action by the state.
There's some positive action measures happening which are very, very welcome and something we've pushed for many years. But they cannot just benefit traveller men or more educated travellers. Those positive action measures have to have outcomes for the whole traveller community. There has to be collective outcomes for all of the traveller and Roma communities.
But I'm wishing for the young people that something good will happen for them and that when they go to look for a job, that they won't be put out the door or discriminated against because they're a traveller.
Travellers and traveller organisations need to be directly involved in the development, monitoring and the overseeing of well-resourced, targeted measures.
At the moment we have a woman representing in the government, Eileen Flynn, which is a great achievement, and again I would like to see more of this.
We're not going to get anything in this world if we don't all stand together in solidarity and fight for it. So that's where I want to be in the future.
Pavee Point has played a significant role in and continues to advocate on the National Traveller and Roma Inclusion Strategy and associated EU Roma Strategy Framework 2020 to 2030. Developing and implementing the holistic traveller education strategy committed to by the current Irish Government. Publishing and implementing the forthcoming National Traveller Health Action Plan. Ireland's compliance with and progress on international human rights obligations under a range of UN Council of Europe and the OSCE conventions, commitments and charters.